It's revision. Dear students, good morning everyone. Can you hear me? Can you hear me? Can you see the slides? Can you see the slides? Okay. Let us begin our session today. My topic is on sustainable development goals, and it's a revision class for you. Before going into the topic, I would like to ask you a few questions. Can you list the common health problems of public health importance or health related problems in India? Keep typing. List the common public health problems or health related problems in India. Keep typing the messages. Okay, very good. Non-communicable disease like diabetes, then maternal and neonatal mortality. Apart from that, very good, mental health. Then, apart from that, health and health related problems. Whatever you are typing are health related problems. Okay, good. Occupational environment. Okay. What about nutrition? Nutrition related problems. Nutrition related problems. What are the problems that are common in India? Malnutrition. Apart from that, any other problems? Okay. Right. Okay, I will discuss all these things in my subsequent slides. Then the next questions are, do you know the infant mortality rate in India? Infant mortality rate. maternal mortality ratio, prevalence of low birth weight, couple protection rate, under 5 mortality rate, neonatal mortality rate. Can you be able to answer any one or two questions from this slide? Very good. Okay, 24. Okay, 31. Okay. 113. What is 113? Very good. Then couple protection rate, %60. Okay. Then under 5 mortality, neonatal mortality. Okay. You see my subsequent slides. This slide shows a trend in health statistics in India related to certain indicators. Coming to infant mortality rate. Remember, infant mortality rate is always expressed 2000 live births. This trend shows how the number has decreased over the period of last 6 decades, from 1951 to 2011. It has even decreased further. When I was doing MD, the low birth weight percentage was about 30%. Now it has reduced to around 16 to 18%. Couple protection rate, the target was fixed as 60%. In 1983, when Government of India framed the National Health Policy, they set a lot of indicators to be achieved by the year 2000 AD. Many indicators we couldn't achieve the target by 2000 AD. So later on, after a period of about 10 to 15 years, we were able to achieve some of the indicators set by the year 2000 AD. Then these are some more indicators. Antenatal coverage. Antenatal coverage means I am talking about proportion of pregnant women who have received 3 or 4 antenatal services, checkups, and received all the basic essential obstetric services that they are supposed to receive during this antenatal care. It's about 74%. It has even increased to more than 80% now. Maternal mortality rate there 2016 was 130 per 1 lakh live births. It has even decreased now to 122. Under 5 mortality rate, it was 39. Infant mortality rate, it was 34, and neonatal mortality rate was 24 for every 1000 live births. These numbers are keeping on decreasing. There's a mistake in this. Low birth weight was around 16% now. It is not 28%. And couple protection rate is about 54%. You had mentioned, Sumitra has mentioned that 60%. 60% is a target to have to be achieved. We are around 53% now. So during exam time, try to remember the common indicators, health indicators. This may be asked during your viva also. What is the current infant mortality rate, maternal mortality ratio, low birth weight percentage in India? What is the couple protection rate? Under 5 neonatal mortality rates. Coming to the topic sustainable development goal. Definition about goal. What is meant by goal? This also can be asked as a viva question. What is meant by goal? See, all of us have goal in our life. That is, each person has a goal in his or her life. So in personal life, it is the desired destination where we want to be in future, and we carry out all our efforts to achieve that purpose. It's a broad positive statement. Actual definition is it's a broad positive statement describing what we want to achieve through our efforts. Like for example, some of you may be thinking, I would like to be the best gastroenterologist or surgical oncologist or a cardiologist in your state, in your town by the year 2030 or 2040, something like that. So every person has a goal in his or her life. Similarly, the government also has goals for the development of its country. So like individuals, the country also can have lot of goals for development. So goal is nothing but the ultimate desired state towards which the objectives and resources of the country are directed by the ruling government. What is meant by target? These are all Viva questions. What is meant by goal? What is meant by objective? What is meant by target? Any definition you can give? No need to be a book definition. What is your understanding about the word target? Because in my subsequent slides, I will be talking about the goal and target for each goal. Okay, I'm not getting any answer. Okay. The targets are nothing but discrete activities that are carried out to achieve the objectives related to that particular goal. So targets are nothing but discrete activities that are carried out to achieve the objectives pertaining to a goal. So this is an example. As I already told you before, goals are nothing but broad positive statements describing what a government wants to achieve through its effort for the development of a particular country. Examples are the government would like to achieve sustainable development goals in India by the year 2030. Government can also set a goal like this: reduce maternal mortality by the year 2025. I have not given the full description of a goal here. This is just an example. So coming to the topic, we'll go you'll have slightly a background towards our topic. So in the year 2000, the United Nations framed the Millennium Development Goals. And in the year 2015, all the countries, almost all nations in the world, came out with this sustainable development goals. So what are these Millennium Development Goals? So in 2000 AD, about 189 states met and came out with this framework of Millennium Declaration. They wanted to reduce poverty, tackle ill health, gender equality, provide education, and take care of lack of accessibility to clean air and environmental degradation. So they established about 8 Millennium Development Goals, and for every goal there should be some objectives and targets. So the targets were set for the period 2015. So see, these were the 8 goals related to Millennium Development Goals. That is eradicating poverty and hunger, then achieve universal education, promote gender equality, reduce child mortality, improve maternal health, then combat infectious diseases like HIV, AIDS, malaria, and then ensure environmental sustainability and global partnership in the field of vaccines and essential medications. So these were the 8 goals related to Millennium Development Goals. We are not going into the details of these goals. We will go on to Sustainable Development Goals. So the Millennium Development Goals had 21 targets and measured by 60 indicators. Out of these 8 Millennium Development Goals, 6 goals were related to health. Then in the year 2015, September, again the United Nations states met and they came out with another development plan for the development of each country, that is called a Sustainable Development Goal. So Sustainable Development Goals, there are about 17 goals in this SDG. So what is this sustainable development means? It's a development that meets the needs of the present generation without compromising the ability of future generation to meet their needs. That is, we should carry out the development of a country in such a way that it should not compromise the future generations' needs. That is a definition for this word sustainable development. So as I mentioned, there are about 17 goals for the world's future that have to be achieved by the year 2030. So the sustainable goal development activities were started. Already existing programs were strengthened or some modifications were made in those programs from the year January 2016. These 17 goals are backed up by a set of 169 detailed targets, and almost all the nations agreed to implement the activities related to development through achieve the sustainable development goals. So how this SDG is different from MDG? MDG was set mainly for the developing countries. This SDG is for both developed and developing countries. It's not that MDG has 8 goals and SDG has 17 goals. That is not the main difference. It is mainly that in the SDG, we have to see the development of a country as a whole, not only in the department, in the field of health, but also in all other aspects like economic development of the country, protecting the environment of a particular country, and taking into consideration the social conflicts that are happening in a country and try to address those. So the three main areas which are focused in SDG are economic aspects, environmental aspects, social aspects in relation to health. And MDGs were for developing countries, SDGs are for both developing and developed countries. I'm not going to talk about all these 17 goals. We are going to see only the third goal, that is related to health. This is just an idea to just to sensitize you that what are the different areas which are being targeted by a particular government. So they have to target on poverty, they have to target on providing quality education, target the direct the activities towards gender equality, provide good environment with clean, safe water and sanitation. Then taking into consideration the economic aspects, providing vocational rehabilitation, economic growth, etc. And like that, there are about 17 goals. Remember, it is not only related to health of a human being, the entire ecology is taken into consideration for the development of a country. If you see this 14th goal, it is about marine development, which was not there in the Millennium Development Goal. What is new about these 17 SDGs? First and foremost, it is the responsibility of everybody. So universality content is there. These goals apply to every nation, every state in that particular nation, and every sector in that particular state, like every city, organizations, private sectors, public sectors, schools, etc. are all challenged to act. This is called universality. Second is, all these goals are interconnected or interrelated. We cannot achieve the objectives set for one particular goal without having any intersectoral coordination. So all the goals are interrelated to each other, and achieving these goals will transform our life and we can live a healthy life in this environment. So the three important components of SDGs are universality, integration and transformation. Another way to look at these SDGs are, as I told you before, MDGs we are just concentrating on the human development in terms of poverty, hunger, education and health, whereas SDG will take into consideration all the three dimensions like economic, social and environmental dimensions. And it is also planning all its activities. The government has to plan all its activities and implement, taking into consideration protection of the people, planet, prosperity, peace and partnership. Coming to the health related goals, it's ensuring healthy lives and promoting well-being for all ages. There are 13 targets in this particular goal. As I told you before, targets are nothing but discrete activities with indicators to achieve the objectives related to that particular goal. So goal number 3.1, that is to reduce the global maternal mortality ratio to less than 70 per 1 lakh live births. I have given you some indicators. See, these numbers will keep changing. Don't worry about the global statistics. It's very difficult to remember, but certain Indian statistics you should be able to remember. As one of you had mentioned almost 122. One of the student had mentioned 122 is the maternal mortality ratio. Yes, UNICEF data shows it's about 122. Still, we have to come down to less than 100. And births, deliveries by skilled birth attendants is about 81% in India. It's almost equivalent to global statistics. Why we have to talk about why we are giving importance to maternal health is, see, the maternal health, maternal death, child deaths and adolescent deaths, these compromise about 50% of the premature mortalities in India as well as in the world, and most of these deaths are preventable. That's why all governments are giving importance to MCH, and right now adolescent is also incorporated in this MCH care. So maternal deaths, child deaths, adolescent deaths contribute to about 50% of the premature mortality that is happening in the world, and most of these deaths are preventable. You know the theoretical background already. These are some of the important causes of maternal deaths in India, like hemorrhage, infections, preeclampsia and eclampsia, complications during delivery, and unsafe abortion. All these problems contribute to about 75% of maternal deaths in India. Almost a similar picture is seen in the global field also. The remaining causes of maternal deaths in India are associated to infectious diseases like malaria and chronic diseases like rheumatic heart disease or other cardiovascular diseases. Coming to the second goal, it's talking about the under 5 mortality and neonatal mortality. That's why I had asked you this question during my previous slides. What is the infant mortality rate and under 5 mortality rate and neonatal mortality rate in India? This is the picture. As per the UNICEF data, the infant under 5 mortality rate is about 34 per 1,000 live births, and neonatal mortality rate is neonatal mortality rate is about 21 per 1,000 live births. So the first goal is related to maternal health, second goal is related to under 5 mortality and neonatal mortality. These are the major causes of under 5 deaths in the world. Acute respiratory tract infections, acute diarrheal diseases, then malnutrition, measles and malaria. These are the important causes of under 5 deaths in the world. Almost a similar pattern is seen in India also. So the under 5 mortality rate in India, if you see, majority of the under 5 mortality rates, deaths happen during the infant period. Majority of the infant deaths happen during the neonatal period, that is the first month of life. So as I shown you in this slide, nearly half of the deaths in under 5 are happening in the newborns, and malnutrition is a significant contributory factor related to the newborn death as well as the infant death and under 5 deaths in India. So SDG 3.1 and 2 deals with maternal mortality, then under 5 mortality, neonatal mortality. So goal number 3.1 deals with maternal health, goal number 3.2 deals with child health. Don't worry if you don't remember those numbers 3.1, 2 and all, but you should know the target group that is towards which the activities are directed. This way I asked you the question during that initial part of my lecture, what are the health related problems. You had correctly mentioned that maternal issues are there, and neonatal mortality is there, under 5 mortality is there. So goal number 3 related to health starts with the improving maternal health by decreasing maternal deaths, and next goal is targeting the children, that is under 5 mortality and neonatal mortality. Can you answer this? What are the 3 delays related to maternal and child health deaths in India? What are the 3 delays in maternal and child deaths in India? And the same applies to many developing countries also. What are the 3 delays? Aurora, Jakar, Maya, any answer? Very good. Delay in transfer. Very good. So delay in taking decision, whether to go or not, that decision affects the health of the mother or the child. Then they may face difficulty in transporting the mother or child to the health facility, that is delay in transport. And third one is delay in the provision of quality services in the particular health facilities. These are the 3 main delays in contributing to maternal and child health deaths in India. So delay in decision taking, delay in transport, delay in receiving quality care. This is a Viva question. Are the maternal deaths declining in India? What is your opinion? Are the maternal deaths declining in India? Yes, good. If you see this particular graph, in the year around 2010, the maternal deaths used to be around 178 per 1 lakh live births. The trend, you can see a declining trend from 178, it had come to 167. Then in the around the year 2014-15, it was 130. Around the year 2016, it was 122. In 2030, we are supposed to achieve maternal deaths. We have to bring it to around 70 per 1 lakh. Even though the number seems to be very small, 70 per 1 lakh, when it comes to Indian scenario, it will be in thousands. See, if I told you, the numbers, see, if you see this in about 150 per 1 lakh or 100 per 1 lakh, 70 per 1 lakh, that will give you a different picture when you see the actual number. So around 32,000 mothers had died in India in 2015 due to maternal or pregnancy related causes during childbirth. And the number has decreased to around 30,000. It's actually a big number if you take the whole proportion of pregnant women in India. So still we have to go a long way to reach that target of SDG target of 70 per 1 lakh 1 lakh live births. Another way to look at this deaths is how many deaths are happening in a minute or in few minutes. So in India currently, for every 20 minutes, a mother is dying somewhere. From Kashmir to Kanyakumari, for every 20 minutes, a mother is dying due to pregnancy or childbirth related cause. That is the current status in India. So when MDGs were established, were we not able to achieve this maternal targets? Yes, we were able to achieve. We were able to bring down some reduction in the maternal deaths and infant deaths and child deaths, but we were not able to achieve the goals set during this Millennium Development Goals in the year 2000. By the year 2015, we have brought down the maternal deaths and infant deaths to a certain extent, as shown in this previous slide. But we have not reached the target set during the formation of this Millennium Development Goals. So we have to still strengthen our activities to reach at least the Sustainable Development Goal of 70 per 1 lakh live births. Similar question, are the infant and under 5 deaths declining in India? Yes, they are declining, but still we have to intensify our efforts. We have to have a robust health system to tackle the problem faced in the life of infants and under 5 mortality in India. We have to bring down to achieve the target of SDG. You can see a declining trend, but the trend is slow actually. So what could be the reasons for the declining rate? I told you we were not able to achieve the target of MDG, but we were able to see a decline in the trend. So what could be the reasons for this declining in maternal rate and child rates? What could be the various interventions that were implemented by government in achieving this decrease in maternal and infant deaths or child deaths? Any reasons you can think about? What are the interventions? Are very good. The institutional deliveries are increased. Very good. Nutrition is provided during pregnancy by ICDS. Very good. Any other? Very good. Essential obstetric services are provided and TT is given to the pregnant women. Very good. So the essential obstetric services and emergency obstetric services facilities are strengthened all over the country. And you would have heard about reproductive, maternal, neonatal and child health and adolescent strategies. These are also implemented. Strategies like JSY has been implemented, Janani Suraksha Yojana, and strategies like Janani Suraksha Shushu Karyakrama has been implemented. Then integrated management of neonatal childhood illness strategies. Due to implementation of all these strategies, this is not the only list, the list continues. So these are some of the main strategies because of which our government was able to bring down a decline in the maternal and child health statistics in India. A few key players to decrease MMR and under 5 mortality rate in India are ASHA workers' role and the important health infrastructure which plays a key role in improving the maternal health and child health is the role of primary health center staff. In this picture, you can see our own AIIMS students, that is your seniors, giving health education to postnatal women in the postnatal ward of Keru PHC. You can see the mothers attending the session, and she is a public health nurse working in the field of Keru. They are all, she is our junior resident. They are all your seniors providing health education. So like this health education has an impact on the maternal health and as well as the newborn health and child health. So coming to the next goal, as already you mentioned, one of you mentioned in the initial, during the initial presentation, that is the NCD is another problem in India, mental health is a problem in India. So before that, there was one more student who had mentioned about infectious diseases. So the goal number 3.3 deals with infectious diseases like HIV, AIDS, tuberculosis, malaria. So these are the diseases targeted during Millennium Development Goals also. In SDG, a few more diseases were added to this component like neglected tropical diseases, hepatitis, waterborne and other communicable diseases. Can you list a few neglected tropical diseases in India? Neglected tropical diseases. Leprosy is a neglected tropical disease. Filariasis is a neglected tropical disease. Very good. One of you has already mentioned filariasis, leprosy. Then, any other? teniasis, helminthic infestations, even rabies, all are considered as neglected tropical disease. Remember, these are not the only diseases that come under neglected tropical disease. There are many diseases come under this neglected tropical disease, like African sleeping sickness, which is not in India. Many diseases are there. You can go into WHO website to have a glimpse of these neglected tropical diseases. Yes, we have program for leprosy, but the activities are not strengthened to the extent which they are supposed to be. Very good. How it is neglected. So the activities that are carried out towards improving the maternal and newborn health, or the activities that are directed towards combating HIV, TB and malaria, a similar type of activities are not directed towards these particular diseases. These diseases are supposed to have eliminated long time back, but still we are not able to achieve, although they were amenable to even eradication. We have not received that particular target because of the political commitment of a particular country towards these diseases. That's why they are called as neglected tropical diseases. These diseases are amenable for eradication, but the activities are not strengthened to that much extent towards these diseases. The activities majority of the activities are directed towards other diseases. Don't worry about the numbers which I am going to show you. Infectious diseases that are concentrated in SDGs are HIV, AIDS, tuberculosis, malaria, and we have to achieve about 90% reduction in the mortalities related to these deaths. Then NTD, also again 90% reduction in the number of people requiring interventions against NTDs. And as I told you, SDGs are concentrating on hepatitis, which is another preventable disease, and waterborne diseases. In waterborne diseases, we have to target on activities related to providing safe water and sanitation facilities. Don't worry about these numbers again. Infectious diseases that are targeted, whatever you should know are, we have to target HIV, tuberculosis, malaria, hepatitis B, neglected tropical diseases and waterborne diseases. Coming to battle against these infectious diseases, how we can achieve is, we have to go for rapid diagnostic procedures. Almost whatever I am showing in this particular slide, if you take TB or if you take malaria or if you take HIV, we have the facilities to handle all these aspects, like rapid diagnosis, effective treatment, effective vaccines are available for certain diseases like hepatitis B. Behavior change is very important if you take into consideration HIV and malaria. Then preventive chemotherapy for neglected tropical diseases like filariasis, helminthiasis. All these strategies are being implemented to strive against the infectious diseases. Coming to the next target in this goal number 3, that is reduce by 1/3 the premature mortality from non-communicable disease. One of you actually mentioned correctly that NCD is a major problem in India now. Yes, so that's why we are targeting this NCD. And a major problem which we face through on this NCD is, among all the deaths that happen in India, more than 60% of deaths are reported due to these non-communicable diseases. During my MBBS and MD period, the situation was different. Communicable diseases were playing a major role, where proportional mortality due to communicable diseases were more compared to non-communicable disease. But there is epidemiological transition now. The pattern has changed. Non-communicable diseases have overtaken communicable diseases mortality. So more than 60% of deaths that happen in India are because of non-communicable diseases now. And even in that, a major part to worry about is premature mortalities are happening in the young age groups. Along with NCDs, suicide rate, death rates also increasing. On an average, we'll come to that later. Premature mortality is a major problem faced in India now, and it's not only in India, all low and middle income countries. more than 80% of premature mortality occur in this particular age group. And cardiovascular disease, most of you know that the leading NCD deaths in globally as well as in India, followed by cancers, respiratory disease, and diabetes. Another component that is added to this NCD is substance abuse. One of you had correctly mentioned mental health as a major problem. So substance abuse is also a major problem which is keeping on the rise in Indian scenarios. So what are the targets that are kept to achieve this particular goal? So we have to reduce the premature mortality happening due to NCDs. Then suicide mortality has to be brought down. Substance abuse habit has to be brought down. In India, the per capita consumption of alcohol is about 5.7 liters per day. So this proportion has to be, it's called substance use now. Yes, you are right. The suicide mortality in India is about, on an approximate number I am giving, it's about 370 deaths are being reported in India, and majority of the deaths happen below 30 years. Suicides among the young are the leading cause of death in the young people. In the year between the years 15 to 29 years, suicides are a leading cause of death next to road traffic accidents in that particular age group. So NCDs are being targeted. Suicide prevention, substance abuse, that is harmful use of alcohol, tobacco, all these things are targeted in NCD related goal. As I told you before, NCDs are contributing to about 63% of deaths in India. In this particular slide, you can see communicable, maternal, perinatal, and nutritional conditions are contributing to about 26% of deaths that happen in India. NCDs are leading with respect to mortality in India. This is the epidemiological transition that has happened in India. So what are the strategies that Government of India has taken to reduce the NCD burden? This program is National Program for Prevention and Control of Cardiovascular Diseases, Cancer and Stroke. So the first thing is health promotion and primordial prevention. That will include your behavioral and lifestyle changes. Then there should be effective screening facilities to screen hypertension, diabetes in the primary health centers. Effective treatments are available now. Human resources, the health team in the primary health center, community health centers are being trained to handle hypertension and diabetic cases. Evidence-based guidelines are available for management of hypertension and diabetes now. And strengthening interventions in tertiary prevention, like going for surgeries and provision of palliative care to cancer patients. All these modalities are being strengthened in India now. Then, as you already mentioned, that mental health is a problem, rising problem in India. How can it be tackled? Efforts are being taken in this way, that is educational approach through schools and colleges. Community approach is provision. This is one technique being followed. Provision of alternatives, like the youth who are getting misdirected into this use of alcohol, tobacco. They can be diverted into activities like sports, etc. You can also come across a lot of successful case histories, like where these youth in slum areas, urban slums rural areas have been diverted from getting into this substance abuse to sports and other healthy recreational activities. Of course, there are some legal approach also to control this substance abuse. Provision of effective treatment, that is effective treatment facilities also are available, and rehabilitation centers are also available, like for example, alcohol de-addiction centers. So I have covered maternal health, then under 5 child health, then infectious diseases, then non-communicable diseases and suicide. These are some of the goals related to health. Moving to other goals. This goal deals with decreasing the number of deaths due to road traffic accidents. This is a slide, I will be sharing these slides with you. So this slide gives you the different picture of various types of injuries that are causing the deaths globally. You can see suicide is playing a major role. Then road traffic accident, almost 1/5 of the deaths due to injuries that are happening globally. Road traffic accidents play a major role. Then poisoning, drowning, and other unintentional injuries. This violence is related to female and vulnerable population. See, I told you that there are 17 goals in SDG. Some of the indicators which are present in other goals are also related to health, like deaths due to disasters, deaths due to homicides, deaths, women and girls subjected to physical, sexual, or physical violence. These indicators are also these targets are also being set in other SDG goals. So I told you these goals are all interrelated. No goal can be achieved alone. And another component that is included in this SDG and not present in MDG was this sexual and reproductive health component was included in this, where family planning services are strengthened, health education is given to the pregnant women, postnatal women. I had shown you in one slide that our AIIMS students were involved in giving health education, and integration of this reproductive health into national strategies and programs. So sexual and reproductive health is given importance under this SDG. And this adolescent birth rate, see this is also being monitored by Government of India. In India, it's about 12 per 1,000 women in this particular age group. Actually, this is not a good number. It has to be brought down. Teenage pregnancies are one of the important causes for maternal deaths in India. Family planning coverage, as I was asking you, what is the couple protection rate? Couple protection rate is nothing but what proportion of eligible couples are being protected. Eligible couple means the women has to be in the reproductive age group of 15 to 44 years. What proportion of couples are protected by either temporary or permanent family planning measures? Currently, it's about 53% in India. We have to achieve a target of 60%. And another component which we have to think about is unmet needs of family planning. It's about 13%. That is, the couple is interested to postpone the birth or limit the birth, but they were not able to access the facilities. This is called as unmet needs of family planning. This is about 13%. This is the current statistics. Then coming to the next goal, this is the important target which we have to think about, universal health coverage. All the goals which I have been talking about before, like improving the maternal health, child health, infectious diseases, targeting infectious disease, targeting NCDs, mental health, adolescent health, targeting the suicide prevention. All these things are the main support by which we can achieve this is providing universal health coverage to all sections of the society in a particular country. So universal health coverage is nothing but all individuals and communities receive the essential health services without suffering any financial problem, and they should receive the essential quality health services in a particular health facility. So how Government of India is trying to provide this universal health coverage to all its citizens are through, for example, financial protection is given through AIIMS Bharat scheme, and the health centers are strengthened. Like you will come across this health and wellness center. So it is AIIMS Bharat can be a short note question also to you. So two components are dealt in this AIIMS Bharat under universal health coverage. That is, one is financial protection, health coverage up to 5 lakhs per family per year is given for secondary and tertiary care, hospitalization, and the facilities have to be equipped to handle the situation. So the health and wellness centers component has been incorporated under this universal health coverage strategy, where sub-centers, primary health centers, community health centers are being strengthened. The infrastructure facilities, manpower facilities are being strengthened in these centers. Coming to the next goal, it's talking about air, water, soil pollution, contamination, along with chemical contamination. What proportion of urban and rural India have access to safe water and sanitation? Any idea? What proportion of urban and rural India have access to safe water and sanitation. And more than 90% of urban and rural area have access to safe water, while sanitation facilities are better in urban area compared to rural area, where about 60% of urban area better sanitation facilities are available, where it's only about 40% in the rural area. So this particular goal is related to safe water provision and safe sanitation facilities provision. And air pollution has to be brought down. It is being documented that air pollution, especially this indoor air pollution, is acting as a major risk factors nowadays for cardiovascular disease, even stroke, then respiratory diseases, and like COPD, asthma, and tuberculosis. So this particular target deals with combating air, water, soil pollution, and chemical pollution. So I have talked about maternal health, child health, then infectious disease, non-communicable disease, including mental health, then environment, adolescent health. Moving to the next one. These are the important indicators, and other indicators related to support these goals are there should be an effective tobacco control, that is substance use, in all the countries. So all the countries have come to an agreement on tobacco control. This particular indicator shows that people above 15 years in India who are using this tobacco, among the males it's about 20%, and in female it's about 2%, but this is not a good sign actually. As present in the Millennium Development Goals, research and development has to be there for development of vaccines and essential medicines, and which have to be provided in the primary health centers and sub-centers. Then the 12th goal is related to health financing and recruitment of health manpower. This is the current situation in India. Health workforce density is about 24 per 10,000 population, but this is also a small number compared to the huge population of India. Then last goal, that is the 13th target related to health, is international health regulation strengthening capacity and health emergency preparedness. Like you are all aware how Indian government is tackling this COVID-19 situation in India, as well as how WHO and other international organizations are tackling this COVID-19 pandemic in India. So these are the 13 targets that come under health. Other targets which support health are, as one of you mentioned correctly, this malnutrition, undernutrition during the initial part of our discussion. This malnutrition is also taken care. Access to safe drinking water is taken care through another goal also. Access to safe sanitation is taken care through another goal also. And the clean household energy is they're talking about air pollution. So all these goals are interrelated to each other. So take home messages are under sustainable development goal. Development means you are taking care of the present generation without compromising the needs of the future generation, and it has to be all the dimensions of development in a particular human being is taken into consideration, like economic aspect, social aspect, and environmental aspects are taken into consideration in SDG development goals. There are 17 goals. The third goal is related to health, and there are 13 targets related to achieve this particular goal. And it is the SDG is a holistic component. It is targeting the development of the people, protecting the planet, protecting the environment, and global partnership. And SDG is being implemented, activities are being implemented in both developed and developing countries, whereas MDG was targeting mainly the developing countries. The 13 targets which I was going through are maternal health, newborn and child health, communicable diseases. In this communicable disease, I was talking about HIV, malaria, TB, hepatitis, neglected tropical diseases, and waterborne diseases. The non-communicable diseases, including cardiovascular disease, cancer, diabetes, then suicides, road traffic accidents, then reproductive sexual issues, universal health coverage, air, water, soil and chemical pollution, tobacco control, development of vaccines and essential medicines, provision of adequate manpower, and strengthening of countries in handling global risks like COVID. So these are the 13 targets that you should remember. SDG may come as a short note, or in any essay question they may add like this, add a note on SDG related to this particular topic. Suppose there is a question on maternal mortality causes and prevention, there can be a short adding to small component in that question, like add a note on SDG component related to this particular maternal health, something like that you may be asked. These are the other goals. I'm sharing the slides with you. I'm not going into these things. There are 17 goals altogether in SHG. Each goal is important in itself, and all these goals are interconnected to each other. So this is the final question for you. Can India progress towards achieving SDG related to health? What is your opinion? This is a question open to you all. You can argue in favor or argue against also in achieving this SDG goal. To an extent, we can achieve the target set by the government in achieving these SDG goals. By the year 2030, we can bring down the maternal deaths, we can bring down the under 5 deaths, neonatal deaths. But it takes, as you already correctly mentioning, we need more effort to achieve in these aspects. We should have a good political commitment to handle this situation's prevailing health situation in India, and our infrastructure have to be strengthened further in terms of money, material and manpower. If Government of India is concentrating and increasing its health budget, which is not happening, which has not been happening over the last decades, if the health budget component is increased and political commitment is more and strengthening of the health infrastructure is possible, then we can make a remarkable progress in achieving the sustainable development goal related targets. And in the year 2030, the numbers which I have shown, the indicators which I have shown, we can see a marked decline in maternal deaths, under 5 deaths, newborn deaths, those reductions in HIV, TB, malaria cases, etc. Thank you very much. Any questions you would like to ask? Gone. Okay. Sharing करना है. Network is that they are coming. Share this. Desktop 8 semester, 9 semester.
2016 8th semester.
Maybe 8 semester batch.